Hi, I'm Sam, the founder of The Wonderhood. I'm a hypnobirthing and antenatal teacher and a mum of 2. For more resources and tips on how to have a positive, empowered and well-informed birth experience, then make sure that you're subscribed to my channel and click the little bell so that you don't miss out on any of my future videos. This video is all about your perineum. I'll teach you where it is, what it does and how you can prepare your perineum for birth to help you reduce your risk of tearing. So your perineum is the skin and muscle between your vaginal opening and your bum hole. It connects your pelvic floor muscles and helps support your pelvic organs. So it's a tiny but very important part of your body. As I mentioned, this is the part of your body that most often tears during birth. Tearing in birth is not a given. Around 25 to 50% of people's perineums will stretch naturally during a vaginal birth and they'll have no tearing. The rate of tearing is lower though if you've already had a vaginal birth. There are different degrees of tearing: 1st degree, 2nd, 3rd and 4th degree. So this describes how deep the tear is. There's around a 25% chance of having a 1st degree tear, which is a minor graze, cut or tear in the skin around your vagina that won't need stitches or any treatment. Yes, it will likely be sore, but it will heal quickly on its own. Okay, 2nd degree tears are slightly deeper. They affect the muscle between your vagina and your bum. So this type of tear will need to be stitched by your midwife straight after birth. The stitches will likely be dissolvable and your recovery is usually very, very quick. They'll use a local anaesthetic and this will usually be done in the place that you gave birth. So you shouldn't need to move anywhere for this. You'll also have your baby snuggled up on your chest at this point, so they'll be a really good distraction for you. Then 3rd and 4th degree tears are slightly deeper again and more serious as they affect the skin and muscle between your vagina and up to your rectum. You'll need to go to theatre for this type of tear, but these are pretty rare. There is less than 7% risk of either of these. If you use the techniques I'm going to show you, then you can reduce that risk to around 1%. So after your baby arrives, your midwife will offer to examine you after birth to check for any tears or issues. But as with everything, this is optional and you must give your consent first. This is how you will find out whether you've had a tear. Okay, now we've talked all about the realities of what can happen. Here are a few things that can affect your risks of tearing. If you're giving birth for the first time, then your chance is slightly higher as your body hasn't worked in this way before. Although, if you're cared for by a midwife rather than an obstetrician, then you're less likely to have any interventions, and this greatly reduces your risk of having a tear. And this also links back to your birthplace. The evidence shows that there are much lower rates of tears when birthing at home or in a midwife-led centre. Now here are 6 things that you can do in pregnancy and during your birth that are proven to reduce your chances of tearing. So 1, avoid an episiotomy. The issue with this is that it's shown to increase your risk of having a more severe tear. So avoiding an episiotomy can help to reduce your risk of tearing. 2, moving intuitively. If you're free to choose a position that works for you during that pushing stage, you're less likely to have a tear rather than being told to lie on your back. 3, warm water. Warm water can really help to relieve pain and help your perineum stay intact. So this can either be in a birth pool, a bath, or even a warm compress applied by your midwife to your perineum while you're pushing. 4 is slow birth. When you feel the urge to push, you should let your body guide you rather than visibly or forcefully pushing down. Take your time, don't let anybody rush you. Gently and slowly breathe as your baby moves down and keep breathing. This will help you to slow it down and allow the muscles and skin to stretch. So listen to your body rather than relying on your midwife to tell you when to push and when to breathe. Okay, last one, but very important, is a perineal massage. So perineal massage is clinically proven to reduce tearing or the need for an episiotomy. It makes your perineum more stretchy and elastic by increasing the blood flow into that area. And this means your skin and muscle can stretch much easier during birth. So Remember that tearing isn't a given during birth, and you can reduce your risk even more by using the 6 tips that I shared with you.